Very good morning. Today our topic is evidence-based practice. When you are in clinicals, this is the most frequent term used in practice. So, what is evidence-based practice? How we define how it is different from evidence-based medicine, and why the word is important. Why? So, to understand the evidence-based medicine, it is usually used by the physicians in their clinical decision making. Evidence-based medicine is a careful usage of all the evidence in the medical literature for the decision making in the care of individual. While evidence-based practice is not only used by the physician but all their healthcare professional, including the nurse, where you can find a systematic method of knowledge to use that knowledge in your clinical practice. So when you use uh, available evidences on the certain problem and with the client's needs, there will be a great results for the patients. So when you use this practice in your clinicals, you will often get know the traditional nurses, traditional healthcare practitioners maybe resist this change. So often they say this was the way we have always done it, means they will not accept the change because they demonstrates the traditional methods. So you should ask why. You should ask why this practice is not changed despite the growing medical literature. So we always hear this word in our clinical practices in our final year of BSN, that evidence-based practices. What is the goal of evidence-based? The major goal of evidence-based practice is to optimize the quality of care and health outcome of the clients to achieve safe, effective, and quality care across the disciplines and settings. So it is the most important goal is to the major goal is of this evidence-based practice is to optimize the care and get a maximum health outcome for the clients. And the question is how we will get these benefit and how will patients get a maximum outcomes. The number one is there are the treatment options that are the based on the science as well as a well informed. So you can follow the treatment best available treatment guidelines. This will improve the health outcome. And when you use literature and practices of evidence base, you will empower the clients. When you empower the clients, they will the shareable of decisions in the clinical decision making. This will improve the quality of life. It will reduce the complications. There will be zero chances of complications. And by using evidence-based practice, it will reduce the healthcare costs. Now, what are the purpose of evidence-based practice? Why we nurses must use evidence-based practice in our clinical practice? Evidence-based practice integrate with the new technology because all the things we learn from the most recent technology, most recent researches. So most research tells that which of the method is the most reliable for that particular interventions. It will also grow the nursing science as a scientific discipline. It will encourage the lifelong learning because when you follow this evidence-based practice, you will learn by time. You will learn the new advancement in the technology, advancement in the medicines. Number four, it will help you to make the decision, and it will help you to be autonomous and perform independently. The fifth one is it will enhance your critical thinking that which is the most suitable method for that patient, that particular patient. So this is the purpose of evidence-based. But here is the most important thing is if you are a nursing profession, you have to learn the relevant things. And when you learn the relevant things and there's a usage and their benefits, you must change the past practices you are doing in your clinicals. So what is the use of evidence-based practice and where we use it in the clinical practice? So when you learn about the hierarchy of evidence, so some studies have a very strong strength, some have a very uh, precisions. Some questions arise in the literature that are the results are reproducible, means the results we are uh, following from the study is worth applicable. Are results applicable across the large populations? Are this studies applied for the whole populations like adults, children's, and geriatric populations? Do the results change when controlled for certain factor like client demographics? Do this study is applicable for all the demography or one of particular regions like uh, in the in the African region or in the North American or the South American regions? So these are the questions we should must ask before the applying the evidence practices. So this was the hierarchy of evidence. What are the types of evidence? How and from where we get these evidence? We get evidence from the random control trials that are the double blind studies, and also we get from the other randomized control trials that are the uh, non non non-random controlled trials, double-blind, single-blind trials. So these are the large studies. So their results are very strong if the journal is authentic and more profounding. We get it. We get evidence from non-randomized controlled trial as well. Get from quasi-experimental studies. We get the evidences from control reports, from the qualitative studies, and the expert opinions. Expert means the person who worked in that particular uh, discipline for more than 15 to 20 years. What is evidence-based practice in the and what are the levels of evidence-based practice? So, if you know about the evidence-based, there's different skills, but the general consists of the level is same. So, level one is a systematic review meta-analysis of all relevant randomized control trial. Level two is a evidence-based from at least one randomized control trial. Level 3 is evidence from well-designed controlled trials without randomizations. And level 4 is evidence from well-designed case control or cohort studies. Level 5 is evidence from a systematic review of a descriptive qualitative study like meta-analysis or meta-synthesis. Level 6 is evidence from a single descriptive or a qualitative studies. Level A7 is evidence from the opinion of authority or the report of experts. So these are the levels we get from the evidence-based practice consensus. So what is evidence-based practice use? And the Oxford Center of Evidence-Based Medicine levels in a five. The number one is a randomized controlled trials, where a systematic review of random controls and individual randomized control trial. Number level two is a cohort studies, where systematic review of cohort studies, individual cohort studies, and the outcome of research. The third level is systematic review, which is control systematic review of case studies, case control studies, and individual case controls. Number four is a case series, and number fifth level is a expert opinion. So, what is the use of evidence-based practice? The Bern framework slightly different. It describes in the three level. Level one is a one randomized control trial with a proper randomization. Level two is a well-designed cohort or case control study with time series comparison or dramatic results from uncontrolled studies. The Bern framework describes the third level is an expert opinion, which is a must in the like a postdoctoral fellow and the professor. How evidence-based become a practice is necessary in our fields. So it create the new knowledge because this is the actual research we are conducting. We are filling the gaps and we are improving the needs of the patient as well as the treatment as well as the practices. On the basis of this research, we recommend new practices on the basis of that research. It disseminate the knowledge because when these studies are published, people of healthcare provide get information from their respective professional organization like National Patient Safety Foundation, American Medical Association, American Academy of Pediatrics, American Heart Associations, and all these organizations share knowledge with their members. WHO is one of them. WHO is a pioneer in dissemination of knowledge. It communicates with all the word in all different languages, and the specific clinical clinicians like if there's a new research in the pediatrics, that particular research is shared with the pediatricians. And if there's a new trend in emergency medicine, this research is shared with the emergency medicine practitioners. So this is the dissemination of blood. So what is the adaptation and implementation installations? So individual from the healthcare or groups or organizations put this knowledge into their practice, and obviously when they put this in practice, it will enhance the recovery of the patient, it will improve the outcome of the care. Maybe it is a complex process and many steps involved, but institutions involved, those institutions who grow and they have a good uh, successful rate of the patients, they use it in their clinical practice. So it's all about the standard of care. Thank you. If any have a questions, you can uh, write in the chat box. Thank you.